to our RDS Synthetic Data workshop. I'm Katie Wilde. I'm one of the co-directors for the HDR UK Scotland region, and I'll be chairing today's session. We've got 3 speakers with us today. We've got Sophie, Lewis, and Kate, and they'll all talk about various presentations around synthetic data and what they've been up to. And then we'll allow some time at the end for some questions. So if you want, as we go along, to pop the questions into the chat, that's more than fine as well, but we'll pick them up at the end for all of the speakers. We are recording today's session and we will make that available afterwards. But without any further ado, I'm going to hand across to Sophie, who's going to kick us off.
Hi there. I'm hoping you can see me. Good.
Yep.
Good afternoon, everyone. I appreciate that synthetic data, it can be quite a complicated subject. So I'm just wondering if we get a bit of a feel for what you guys know about synthetic data. So on the bottom of the screen, you should have a react button. So could we go for some kind of a thumbs up if you are quite new to synthetic data, and a big heart if you have used synthetic data in your work or have some understanding. So we'll see if we get a bit of a feel about what people know. So we've got some newbies to synthetic data, and we've got some people who know. So my apologies, my presentation is just going to be very much a introduction to synthetic data, but I know that Lewis and Kate will go into a bit more detail. So I'm just going to try and share my screen. Fantastic. So I'm hoping you can all see this, and I apologize if any of you have seen this presentation before or something similar. So I just wanted to give an overview of synthetic data and what Research Data Scotland is doing in the field of synthetic data. So what is synthetic data? Just for newbies, synthetic data sets follow the same pattern and structure as the real data sets they are based on, but they contain no information about people or indeed places. Each piece of information in the synthetic data set is usually designed to be plausible, but is created at random based on the structure of original real data. So what do we mean by, so I think that's just skipped one. Right, so I just want to talk a little about fidelity. Sometimes we say synthetic data is very much like real data, and we call that high fidelity synthetic data. But where the synthetic data is less like the real data, we call that low fidelity synthetic data. These definitions can be quite broad, and they can overlap a bit. It's not precise, but maybe just to show you an image that maybe help you understand a bit better. This is a screenshot of me that I took a couple of days ago. That's real me. This is my high fidelity Photoshop. So you can see it's very similar to me. And this is a low fidelity me. That's my avatar that I often use in Teams meetings. Now, the point is, sometimes you need real data. Sometimes you need high fidelity data. And sometimes, you know what, low fidelity data, synthetic data is good enough for purposes. So it really depends on your use case as to which fidelity synthetic data or even the real data is required. So why is RDS interested in synthetic data? Well, broadly, one of our main aims is to speed up research. Now, synthetic data sets can be used by researchers at the start of the work, particularly for data discovery and code development, whilst they're waiting for approvals or even access to the real data. But it should be noted that actually we never use, well, it's never designed to use the real data to make real analysis or real decisions. As far as we're concerned, we are looking at using a low fidelity synthetic data, which would not be good enough to make any decisions or analysis from. So the first thing we did was we engaged with our researchers, and they're the ones who gave us the idea that actually it was the low fidelity synthetic data that they were interested in. But we've also worked with the public to understand their concerns. We talked with the SCADA public panel. There's been a lot of work within ADR UK working groups on synthetic data, and also more recently on the Scotland Talks Data public panel. So we balance the needs for researchers to get access to synthetic data in a friction-free manner, whilst working with the public to understand and address any concerns that they have. So that's been our way of bringing synthetic data to life. So how are we making synthetic data available to researchers? So last year we were approached by National Records Scotland, who said that they have a synthetic version of Census 2001 and Census 2011, and from that they developed low fidelity synthetic data with about 5,000 rows, which have come from 5 million records. So we launched that to become available in our metadata catalogue in December 2024. And one thing to note is we make sure that the synthetic data that's provided is as thoroughly checked as we possibly can be. This is something that came through from the public panel. We make sure that the synthetic data is labeled as being synthetic, that the structure of the synthetic data is as comparable as possible to the real data. We ensure that processes to ensure privacy, so disclosure control checks are put in place. And we ensure that the synthetic data is adequately documented so that people that use the synthetic data understand where it is similar to the real data and where it is different. As I mentioned, you can get access to the synthetic data through our metadata catalogue. You just need to search Research Data Scotland and the metadata catalogue. And this is kind of how it looks. If you scroll down to the bottom, there's a field that says apply to access synthetic data. And all that's required is your name, your organization, and your email address. We ask you to sign an end user license agreement, which basically has 3 bits to it. It's a glossary of terms, the disclaimer, and the usage restrictions, which basically is about making sure it's for not-for-profit research, training, and educational development, and where it's used in any publications to cite the synthetic data and acknowledge the synthetic data. What are our next steps? So as well as hosting the synthetic data from NRS, we have developed code in R to generate our own low fidelity synthetic data. So we made sure this process is scalable and automated, and it uses just the metadata to generate synthetic data. Now, as such, it's quite dependent on the quality of the metadata, but generally, you know, we're getting some progress as to being able to generate some low fidelity synthetic data. One important point is that we make sure that it's quality and disclosure checked against real data. So we've developed an R report that takes our synthetic data, any synthetic data that we generate, and that it can be then compared against real data. Now, this is really important because although we recognize that, you know, it's not that difficult to generate synthetic data, anyone can do it. The point is, by bringing in these quality checks and standards, is really important to understand sort of the properties of the synthetic data and how it might relate to the original. It keeps it safe and is really important for protecting privacy and disclosure. We've been working with ADR Scotland to develop synthetic versions of some of their education data sets, particularly pupil census, absences and attendances, exclusions, and so forth. We're also been looking to see whether we can generate synthetic versions of health data sets, looking at some of the Public Health Scotland offerings, particularly the SMRs. Can we make synthetic versions of that, which would be which we could then make available on our metadata catalogue? The answer to that is yes, we can, but we're not. There's a few teething points we would like to iron out and think a bit more, because although we can do it, is it quite right? And are there privacy issues? We haven't really resolved all of that yet. So over to you. Do get in touch if you're interested in synthetic versions of Census 2001 and Census 2011, but also get in touch to tell us if there's any other synthetic data sets you'd be interested in. Finally, what would you be liking to use your synthetic data for? Because that's the important point that governs what fidelity synthetic data that you need, so we can be sure that we are generating the synthetic data to meet your requirements. And yeah, any other questions, write them in the chat, or anything else you'd like to hear about, do get in touch. And I'll just leave it there for questions.
Perfect. That's great. Thank you very much, Sophie. So as Sophie says, if you want to pop it into the chat now, or we can wait until the question and answer session, which we'll come to at the end of today once all speakers have spoken. So we're going to move across to Lewis now, who's going to talk us through some of his work that he's been doing on the governance side of things. Lewis.
Great, thank you. Can you see my screen? Yeah.
Yep.
Great.
Yep.
Okay, so hello everyone, I'm Lewis and I'm the Research Officer at Dementia Platform UK, and I lead the UK Synthetic Data Community Group, where we're looking at developing governance, tools and resources around synthetic data for trusted research environments. So our group is funded by DARE UK as a community group, and we are led by a number of different co-chairs with lots of different experience across many different organisations with synthetic data and sensitive data research. And many of these co-chairs have already got established synthetic data working groups. Emily leads the ADR UK one, Sophie the Scottish one, and there's also lots of different projects going on. So with this community group, we really wanted to build on existing work in synthetic data across the UK and really bring together the kind of understanding to build consensus when it comes to developing the governance around synthetic data for, across the fidelity levels. So just to provide a bit of context, we've been doing a lot of work within Deep UK and wider across SERP, including the SAIL Databank, to be able to develop synthetic data tools and incorporate them into our trusted research environments. So within Deep UK, we've developed our own methods and tools to be able to generate synthetic data at 3 different fidelity levels and make those available for lots of different purposes. One of those that we're really interested in is in federation and how synthetic data can help to support federation. So at the moment, we utilize the TREFX solution where you can't actually see the data. You can only send queries and get results. Now, synthetic data is the perfect use case for this, as it allows researchers to write their code and analysis pipelines on synthetic versions, ready to be sent off across different data environments to be able to get their results. We're also interested in how we can use this to enable researcher training in lots of different areas and lots of other different purposes as well. There's also a need for synthetic data across many of the different DARE UK projects. So last year, the AI Risk Evaluation Group identified privacy-preserving differentially private synthetic data as a useful technique for developing private AI models that can be released from trusted research environments. As I mentioned, federation, also a key aspect to being able to use synthetic data, and also looking at how we can generate synthetic data in the Trevolution project to help support training in AI disclosure methods and assessments. So there's lots of different use cases across the trusted research environment community for how we can actually use synthetic data. But at the moment, the governance is not quite there for synthetic data. It's fairly new within TREs. And so this is why we set up this community group to kind of look at how we can develop the governance and policies across these different fidelity levels to be able to make sure TREs can integrate synthetic data into their processes. So the kind of aims of this group was to host a series of workshops with different stakeholders to understand how we can implement synthetic data in practice and put together an overall governance framework to be able to help support TREs to enable that. So we've got 4 different workshops. We just held one in April with researchers. We've got one coming up in June with experts, one in August with data owners, and a final one in October with members of the public. So our researcher workshop really focused on identifying what are the use cases for different fidelity levels of synthetic data, and what are the specific requirements that users expect from that synthetic data for a range of different purposes, whether that's researcher training, or federation, or private AI models. All of these different types of synthetic data require very different requirements. So we really wanted to get an understanding of what specifications we need when we're generating these synthetic data sets. So as Sophie mentioned, synthetic data exists on this kind of spectrum of fidelity. And for the purposes of our workshops, we kind of categorize these into 4 main categories of fidelity to be able to help understand in the discussions and questionnaires with the researchers when it came to looking at the requirements of these. So we kind of have structural synthetic data focused on just kind of value ranges, completely random data, but making sure it looks structurally similar. One up from that, we have synthetic data, which matches the kind of marginal distributions, but preserves no relationships. Up from that, we have synthetic data, which does maintain relationships between variables. And at the very high end, we have kind of augmented synthetic data sets, which is very similar to the original data. And you can see kind of a visualization of these different fidelity levels. So we can generate these different levels of synthetic data for a number of different purposes. Now, when it came to looking at what the most beneficial use cases were in synthetic data, we saw things like supporting code development while waiting for access to data, being able to support training and teaching, and supporting data discovery. Those were really the 3 main benefits, top use cases of synthetic data. And then, of course, other areas like federation, privacy-preserving AI, and enhancing analysis. Now, across all of these different use cases, we asked our researchers in the workshop, what kind of requirements do we need? What level of requirements do we need for each of these different use cases? And this really gives us a good understanding of how we should be generating synthetic data to meet the needs of the users for these different areas. So if we have a look at the level of synthetic data needed for these, obviously we can see for privacy-preserving AI and enhancing analysis, we really need these higher level of fidelity synthetic data sets. But for purposes like code development and data discovery, we only need these lower levels of fidelity, where we only have structural information or basic kind of univariate marginal distribution information. When it came to quality and utility, obviously, again, privacy-preserving AI and enhancing analysis, we need high levels of these. But when it came to these other lower fidelity ones, there was much more of an importance of making sure that that data was of high quality to be able to support these different use cases. When it came to size, again, we saw kind of a distinct separation between the lower fidelity and higher fidelity, where in the lower fidelity ones, we don't need many rows of synthetic data to be able to support these things, whereas for the higher fidelity ones, we need the same amount of rows or more in some instances. But access control was really the key area between these different fidelity levels. For these lower levels of fidelity, it was really highlighted that these should be easily accessible. This was identified as one of the most important factors for these different types of synthetic data, that it's made easily accessible outside of trusted research environments with low barriers. And that was really important for these lower fidelity ones. For the higher fidelity ones, these should have a lot more safeguards around them, but still easier to access than original data, apart from more advanced higher fidelity synthetic data. But as well, documentation was seen as highly important across all of these different use cases. So we really need to be making sure that all of our synthetic data, no matter what the purpose, is generated with high documentation, with transparent methods and evaluations as part of those. So, as I say, across these use cases, we've really got a good understanding now of how we should be generating synthetic data across these. And we kind of discovered there's these 2 very distinct types of fidelity of synthetic data. These lower ones, which are focused on easy accessibility and good quality. And it's interesting that the most beneficial use cases were identified as these lower fidelity ones, the code development, data discovery, and training and teaching. This is really where we should be focusing our efforts of generating synthetic data to support to researchers in interested research environments. Then for our high fidelity ones, these should really be focused on kind of size and utility and making sure that they are well documented for those use cases. Now, from these results as well, it was also clear that we need different levels of governance depending on the fidelity levels of synthetic data. So for this kind of tier 1 governance level, this is for the lower levels of synthetic data, those kind of structural or univariate ones, where they should be made easily accessible with maybe just a user agreement for researchers to be able to easily access outside of trusted research environments. Then the next level up, the kind of tier 2, it should be a lot more controlled. That synthetic data, which kind of maintains the relationships, should either be made available within trusted research environments or with other appropriate privacy safeguards in place. And then, of course, for kind of the augmented synthetic data sets, these need to have the same level of governance as the original data sets. So our next workshop is with experts, and this is in June. And so this is really to take the requirements and use cases that we developed from our previous workshop and take these to domain experts to understand the best ways of generating and evaluating synthetic data for these different use cases and different fidelity levels, and kind of come up with a set of metrics that we can use and a kind of framework for communicating those metrics to help data owners and trusted research environments make informed decisions when it comes to releasing synthetic data sets from TREs. So we've got quite a good lineup of speakers for this event, and you can still sign up. We've still got a few places. And this is really bringing together people who have worked on developing synthetic data, looking at the evaluations across different fidelity levels, so that we can understand and have these discussions around how we make sure synthetic data is private and useful for these different purposes. Then in July, we'll have a workshop with data owners and people working within trusted research environments to understand how we can develop the governance and policies for synthetic data for these different use cases, and what some of the issues or challenges may be with kind of making decisions on synthetic data release, and how we can help to alleviate those with kind of the evaluations and reporting that we give to data owners. And finally, we'll have a workshop with members of the public where we'll take our final governance framework and results from all of our previous workshops to members of the public to get their input in refining the final governance framework that we put together for enabling synthetic data within trusted research environments. The results of these workshops will also help to inform kind of open source tools that we are developing and making available within the TRE community to help other TREs to be able to automatically generate different levels of fidelity depending on these different use cases from their data sets. And also looking at how we can put together standardized documents for reporting kind of the evaluations and visualizations of the synthetic data. So hopefully with all the results that we get from across these workshops, we'll be really able to start to understand a lot more about the governance of these different levels of fidelity and hopefully start to implement these within practice. I'm happy to answer any questions towards the end of the session. Thank you.
That's great. Thank you very much, Lewis. Do you want to pop the link in for people for the June event as well, if you're able to do that?
Yes, I'll do that now, yeah.
That'd be great. Like we say, we'll take some questions at the end, but feel free to pop them into the chat now if you want, and we'll pick them up. And now we're going to hand over to Kate to talk about approaches in the Scottish Safe Haven Network.
Thank you, Katie. So, hi everyone, I am Kate O'Sullivan, formerly of the Scottish Safe Haven Network, formerly at the University of Aberdeen and the Grampian Data Safe Haven. I am now at the University of Sheffield as Head of Secure Data Services and the Yorkshire and Humber SDE, part of the NHS England Secure Data Environment Network. So just to get my screen sorted. So we undertook, and this is a really nice kind of segue from Lewis's presentation. So as part of the Scottish Safe Haven Network, we are a federation of the regional and national safe havens in Scotland. So many of you will know the work that we do, but also just for those of you that aren't aware, we have the National Safe Haven, which is Idris at Public Health Scotland. We have the Grampian Data Safe Haven at the University of Aberdeen, the Health Informatics Centre at the University of Dundee, Data Lock at the University of Edinburgh, and the West of Scotland Safe Haven, which is from NHS Greater Glasgow and Clyde and the University of Glasgow. So we were looking at how would we actually operationalize and how would we actually put in place kind of a sort of federated approach to synthetic data across the Scottish Safe Haven Network. We have a long and robust history of providing unconsented patient data for research purposes, but interestingly, it is really difficult to actually do federated projects in Scotland thus far. And so we were sort of looking at synthetic data as a mechanism for moving on to thinking about federation as a kind of first step. So there we go. So our main two objectives were how we're really kind of thinking about how we can create a federated solution within the Scottish Safe Haven network to address kind of two main challenges that would facilitate researcher access to data. So we broke these down into the technical and infrastructure conditions that would be required under which synthetic data could be made available, and then the information governance controls. So inextricably linked, but we thought we would take very much the approach of looking at IG and the kind of ethics around synthetic data, as well as the technical and infrastructure and kind of access controls to it. So the first thing that we really kind of wanted to assess was whether our researchers actually wanted to use synthetic data. And this kind of came out of some conversations that we had with researchers where we really needed to bottom out. There's lots of discussion in the wider TRE community about the benefits of synthetic data, but we needed to know whether actually researchers did want access to it. So we did a survey of users across the Safe Haven. So prepared a survey that was sent to all of the researchers actively using Safe Havens to identify interest in synthetic data and whether there are barriers in place that are actually preventing researchers from engaging with synthetic data, and also perceived barriers. So what were their perceptions that they would have about gaining access to synthetic data? And we wanted to identify the kind of main uses of interest related to synthetic data. So very, very nicely off the back of the work that Lewis just shared. So we had 26 respondents to our survey, and they ranged from across the gamut of our users. So typically we had kind of our main user base, so professors, research fellows, research leads, lecturers, but also students, statisticians, postdocs. And so we had a really lovely kind of spread across the different kind of roles of our users, but also the different levels in terms of their kind of career progression. We really, as I said, we wanted to tackle the main question of, do our researchers actually want synthetic data? And they very much did. So they were very keen to use synthetic data, and what they were really wanting actually was synthetic data from multiple safe havens, and they wanted a single application process. Currently, when researchers access data across the safe havens, if they want the regional data held in the regional safe havens, they have to apply for separate permissions to that regional data. And so it was very obvious right from the start that they wanted synthetic data, they wanted it via a single application process, and they wanted it from multiple safe havens. So from that basis, that was a really kind of useful start in us thinking about mechanisms for federation. They were also very clear on the uses that they wanted synthetic data for. So the highest response was to write their analysis code. So again, this is where researchers will be able to write their code whilst they wait for their specific project data, thereby speeding up kind of results at the end of the process once they have their project specific data. 81% wanted to understand the data set and structure. This is largely because the data is obviously held within airlocked environments. Researchers can't see the data itself. And so oftentimes when they're choosing data sets and variables, they're really kind of struggling to know exactly which data set, which variable to choose, and also the kind of data types that sit behind it, kind of distribution of values, etc. They also wanted that, they wanted the kind of to help select data set and variables. They were also interested, 31% were interested in whether they could do kind of cohort feasibility. So this would be where they were trying to determine whether the cohort, where there was a sizable enough cohort within the regions. And then other was 27%. So the 27% of other were two main reasons. One was to write, was to train AI models, or to write kind of model training algorithms. And this was very much kind of the kind of highest fidelity that Lewis spoke about. For our purposes, because we were also doing that kind of engagement work around information governance, we determined the kind of AI component of this to be out of scope, simply because that would require much more significant kind of access controls, or we assumed it would require different access controls, but also different purposes, use purposes. And therefore, for our kind of our focus, we wanted to really kind of drill down into low fidelity synthetic data. So things that were easily generatable, but also that could fulfill those kind of main purposes. So we then, so knowing that we actually had users that wanted to use synthetic data, we engaged with the wider information governance community across the Scottish Safe Haven network. So these are Caldecott Guardians and data protection officers, largely that sit within the health boards, of which the data controller health boards, and on behalf of which the safe havens are data processors. So we did a number of interviews with stakeholders, so Caldecott Guardians, DPOs, around Federation generally, and also the kind of idea of data sharing and data pooling. So data sharing and pooling is where you would kind of pool all of the data together to see whether actually synthetic data is an opportunity for this. As well as what Lewis kind of mentioned, which is federated analytics, where a researcher writes a query, that query gets distributed out to specific partners within the Federation, and the analysis comes back. One of the challenges that you have with sharing and pooling of data is obviously bringing that all in together in one location. And for information governance colleagues, there is a bit more of reticence around that the pooling of data, where they lose the kind of control, the controllership of that data. Federated analytics, on the other hand, can be incredibly challenging if you do not have a common data model. And even if you have common systems, such as what we do in Scotland, where hospitals use similar systems or the same system, we know that systems are customized, but you also have local data capture practices, which require quite significant and intensive kind of data discovery around that data that's held within local hospital systems. And because of all of this, our interviews showed that there were varying risk appetites. So one safe haven does offer synthetic data already. However, another safe haven was very, very explicit that although they understood synthetic data is not real data, they were concerned about the impact of a data breach and that it could be damaging in terms of reputation. We also had, and this was something really unexpected, where we weren't anticipating this, but actually it makes a very good point. There was significant concerns about exposing the data structure of databases that are the same data structure as the live hospital data. So if we were looking at regional data, where the data that the Safe Haven was kind of extracting and creating project-specific data from, where the variable names or the data structure was very similar to the data to the live hospital system data. So in effect, every variable name was similar or the same as the actual real data. There was concerns about just risk of infrastructure exposure, where the data structure itself was very similar to the live hospital system. So we kind of took the view that because of the concerns and the kind of varying risk appetites, we had to go with a kind of lowest risk across the Federation. So from that, data controllers were only comfortable with synthetic data being built from regional data for research, and it had to be within a safe haven. So whilst Lewis was talking about the kind of low fidelity data that could be very publicly available, some of you may know that NHS England have their hospital episode statistics as open source. Which is very, it's a small cut of the hospital admission statistics produced by NHS England, but it is available on the NHS website and the NHS digital website. Our data controllers were comfortable with the kind of lowest common view was that the synthetic data for regional data in Scotland should only be accessible in a safe haven. They also were clear that the infrastructure should adhere to the 5 safes. And to enable federated synthetic data, Federation should demonstrate compliance with the Safe Haven Charter, existing accreditation standards, and existing information security management. So from that kind of, we know researchers want access to synthetic data, but we know IG colleagues are have concerns around that data being exposed just in a kind of open format. We looked to thinking about our infrastructure, our architecture, and the principles under which we could offer synthetic data in a federated mechanism. So we used the SATRA, so the Standard Architecture for Trusted Research Environments. So we used the SATRA specification to assess our equivalence across the network to ensure that we had the appropriate levels of controls across the infrastructure and architecture of our environments. There were only 2 areas where we didn't have harmonization, one of which was just around a kind of assumption that data is always encrypted, which works in a cloud environment, but when you have on-prem kind of secure servers, you don't need data encryption because they sit in a secure compute facility. And that is the equivalent of kind of encryption at rest. We also weren't all at the time publishing our data use registers, but subsequently have. So in effect, we were all, we met full compliance with SATRA across all of the pillars. So we knew that our environments had that equivalency requirement. They met the 5 safes criteria. And so then we wanted to look at the kind of use cases and limitations. So again, this looks very similar to what Lewis presented, where we looked at the kind of main reasons that researchers wanted access to the synthetic data and kind of the things that we needed to do around kind of maintenance and how we could offer this. So in terms of some of the interesting things that kind of came out of this, so again, for TRE familiarization, so just how the TRE works, how data is available, that is low fidelity, very low maintenance, etc. For variable selection, etc., we know that there is a range of fidelity that could be offered, but there is only minor updates and data sets and variable changes kind of that needs to be done sort of on an annual basis. Similar with code development, low to medium, it also only requires sort of minor maintenance. And then again, we come back to model development, for example, which is obviously medium to high. You need major frequent updates. And again, this is where we kind of said high fidelity synthetic data is out of scope. One of the things that we kind of made the assumption about, which ended up being really interesting, was around feasibility of cohorts. And this was just simply, could the synthetic data we offer mimic the population of our regions? And actually, what we determined through the work that we did in kind of investigating synthetic data is that feasibility is actually high fidelity, and it also requires frequent updates to reflect the whole population data. So whilst researchers may want to do this, and again, say the safe havens may want to offer kind of cohort feasibility via synthetic data, it's simply too much overhead to kind of offer that at this stage. So we then moved on to the kind of proposed controls around synthetic data. So, and again, this is coming out of that kind of governance piece where if we offered basic synthetic data and the kind of infrastructure controls, we would need to do user registration. We would need to have users undertake accreditation and information governance training. We would need to offer a fixed time limited access. We would need to think about costs around this. So do we offer, is it free? Should we have fixed costs? What software might be required, what compute resources might be required, what data availability might be required, and the kind of outputs. So for the basic scenario, we know that we would want to have just standard applications in terms of software. Compute resources would be limited and fixed. Data availability was, again, trying to make sure that we had all of the data sets available. And then outputs, we would not actually need to do output checking because the code would stay in the environment if they were developing code. And where we would actually undertake a more involved kind of approach to synthetic data access, we would also need to do user registration and user accreditation through governance training. Could we share with individual users or also groups? Again, time limited access could be variable, costs could be variable depending on what researchers wanted. We could accommodate alternative software, alternative compute, but then any outputs from that more involved scenario would also need to undergo output checking. We then focused on the kind of practical information from an information governance standpoint. So again, we narrowed down the viability of the use cases for low fidelity synthetic data to data set and variable selection and code preparation. We recognized that there would need to be that controlled access. We would need to have an agreed consistent period of access depending on the use case. So for data set and variable selection, it would be 1 month, but for code development, it could be anywhere up to 6 months. We also then took that kind of federated approach to this, and we created a single application form with delegated and coordinated authority. So we all agreed the data request form, the questions, the criteria, the information that researchers would have to provide. And then we all agreed that there would need to be cost associated if it wasn't linked to a funded, ethically approved project. So simply because of the overhead of needing to onboard users and set up kind of workspaces, etc. We also determined that we would need to prioritize which synthetic data would be produced in the same order. And that way, again, to enable federation, we wanted to make sure that the kind of federated component of things was consistent and clear, and that researchers had access to the same data across the environments. And we also kind of a kind of main finding was that actually the most important thing is that we also needed to generate our synthetics data in the same way to ensure that parity across the federated projects. And that's it. So I just wanted to say a massive thank you to Research Data Scotland and Sophie and Ely for supporting us through this work, to the Grampian Data Safe Haven team, particularly Anto, Helen, Yarek, Stacey, and Katie, at Data Lock, Amy, Pam, and Kathy at West of Scotland, Charlie. At the Health Informatics Center is Jen, Chris, and Chris. And at Idris, it was David, Michael, and Jackie. And they did an incredible amount of work to kind of, again, bring together this group across Scotland, where we were able to actually kind of really think about federation across our environments, but also think about all of the complicated operational components of being able to undertake this work. So I shall stop sharing.
Thank you very much. So thank you to Sophie, Lewis, and Kate. So hopefully that's given everyone a bit of a taster. There's a few questions that have gone in the chat. I'm going to open it up if anyone's got a question that they want to put their hand up and ask. What I should also just say, in the chat, there's been a link put to an intro to synthetic data, which is on the RDS website, and Lewis has put in his links to the workshop and also a user requirement. And there's some good different chats around OMOPing and different data sets. So any questions from anyone? Ooh.
There are some really interesting comments in the chat about OMOP and common data models. Having just supported a federated project trying to bring together data from across just one region in England using OMOP, it turns out that OMOP is great at an organizational level and really difficult at a kind of regional level, where the provenance of the OMOP hasn't been captured, and again, where local data capture processes are so varying in hospitals, trusts, health boards, etc. So if one ward is capturing different data in different ways than another ward at a different hospital, even if you OMOP that data, it isn't always the case that the OMOP aligns. So just as CDMs are great, and I think that they're really helpful in understanding data, but they don't solve everything.
They don't. Right. Food for thought. Let's bring Gillian in with a question. Gillian?
Thanks. Yes, very nice. Thanks very much for really great practical talk. Good to catch up with all of this. I don't think you mentioned this. Apologies if you did. But I think one thing that's tremendously important in relating any sort of synthetic data is making sure it's being labeled properly. Now, I was working with Sophie for procedures for checking low fidelity synthetic data, but it applies even more to high fidelity synthetic data, that you've really got to make sure that when people look at the stuff, you know, you made comments about people thinking it was real. Well, you can change the variable names with prefixes and suffix, and we have some practical suggestions there. But anyhow, I thought that might be helpful to remind you of it. Thank you.
That sounds great. Thanks, Gillian. Any questions, Lewis? You want to come in and say anything?
I was just going to say this is something that we're going to explore actually in our next workshop, the expert workshop, where we can look at how best we make available these synthetic data sets, as you say, how we label them, how we make sure that they are well documented, people know how they've been generated and evaluated, what they should be used for, and how we make sure that they don't go outside of those bounds as the original purpose that it's been developed for. So hopefully this is something that we delve into a bit more in our next workshop next month.
Perfect. And I guess one of my questions, and I'm going to put you all on the spot, speakers, but just, and I know, Lewis, you've got your general public one coming up later in the year, but any suggestions on what the feeling from the general public is around the use of synthetic data? Sophie?
We had our Scotland Talks Data panel discussion earlier in the year, back in January, and we had a lot of support for what we were doing, especially the concept that it would allow researchers access to data more quickly, and the benefits of that. So the public were broadly supportive of that concept. the concerns that we have identified have been around maintaining enough privacy. It doesn't have to be a lot, but just making sure there's a little bit of control over the way the synthetic data is made available, and a bit of human oversight. And that is why when we make our synthetic data available, it is checked by a human that the person applying for the synthetic data is a bona fide person and not just a bot or a computer.
Okay. Any further comments from Lewis?
Yeah, so we did some public involvement with the SAIL consumer panel about this, and they seem generally very accepting of synthetic data and understanding that the benefits that it has. What their main concerns were amplifying biases within synthetic data, especially when using that to kind of enhance data sets, balancing classes in AI models, all these other kind of things, kind of that amplification of bias. Although synthetic data can be used in some cases to address bias and generalizability, they had concerns around that. And they also had concerns with kind of the lower fidelity synthetic data sets or very highly private synthetic data sets, which can remove people with kind of rare conditions, minority groups, and really push them away. And that's what their main concerns were. So again, in our next workshop, we're hoping to explore some of these issues and how we can address those. But yeah, those were their main concerns.
And Kate, I can see you nodding there. I think you got some of the similar things, didn't you? And definitely that human involvement as well from some of the other public engagement work that you've done.
Absolutely. It's very much the public are very much want the kind of human intervention. They want human oversight, etc. And I think synthetic data is obviously written based on human code, which is great, and it's where code is kind of is generated and just kind of left to go, and where it might potentially kind of become into the kind of ML AI side of things. That's absolutely not what we were sort of talking about in terms of generating synthetic data here. I think this very much speaks to what Lewis was saying around the kind of concerns about bias, concerns about removing small but important communities from the data that could then lead to bias.
Yep, perfect. Gillian, did you want to come in?
No, it's all right. We've moved on.
Okay. All right. So is there anyone else that wants to ask a question? I know there's a specific question to Kate in the chat just around that concerns raised by some of the Caldecots around the exposing the data structure. And there's a question whether this was investigated, like around the basic statistics of data would get exposed.
So I think there needs to be a distinction made between where the synthetic data resembles the kind of databases. The Caldecots and DPOs felt that was a security risk to the security of their whole hospital system, where you're publishing data that effectively, or synthetic data that could potentially expose a kind of information or cybersecurity risk to the hospital systems. They were less concerned about kind of basic statistics where it was absolutely not going to kind of identify individuals, etc. So if you're talking about like a field being 50% incomplete, like some fields are, they weren't overly concerned about that kind of level of metadata, but where the data set or the data structure itself was very similar to the data as it exists in the system. They had that concern from a cybersecurity perspective.
Perfect. Okay. Any other questions from anyone? Ooh. Well, it is 5:02, so I will let everyone head off. But before we do that, thank you so much to Sophie, Lewis and Kate for your presentations today, to Serena and Rachel for getting this all organised, and for those at RDS that have helped support this. Our next event, Serena has just posted into the chat, which is our Scottish Centre for Social Research event that we're hosting with them, which is on the 24th of June. And you can register for that following the link in the chat. Any feedback, any questions, please reach out to the email in the chat as well. But thank you very much, everyone. Thank you.